So our next presentation is by Dr. Allison. Chelsea Allison is a assistant professor of nutrition and exercise science at Springfield College in Springfield, Massachusetts. She graduated from the University of Tennessee in Knoxville in 2021 with a Doctor of Philosophy in Nutritional Sciences and a concentration in community nutrition. She completed her dietetic internship in 2020 and took the exam to be a registered dietitian in 2021. Her research interests include disordered eating, body image, and diet culture through a lens of health equity in food systems. She's currently receiving her certification to become a certified intuitive eating counselor. So I'll turn it over to Dr. Allison.
Hello, everyone. Today I will be talking about priorities of college communities. So I will be specifically talking about the development of a campus priorities survey. So I will go over the purpose, then followed by the conceptualization, methods, findings, and future applications. So we developed this to determine the top priorities of health policies and initiatives on college campuses. We wanted to be able to understand what people in our college communities wanted before just creating programs and implementing interventions to make sure we were having significant changes in efforts for health. And so we created this as an evaluation. So asking about interventions, what policies needed to be changed, and what initiatives were at the top priority of students. So we validated this for college students, but with the intention that hopefully it will be validated later for administration, faculty, and staff to get the entire picture of our college communities. So for our methods of development, we did item generation and development, followed by data collection for a pilot sample, and then factor analysis. To generate our items, we first used community input. So Get Proved was a CBPR project. And so we had 2 town halls at 2 different universities led by students. And pretty much we went in and we had questions about different areas of health. And students just gave us their concerns, their thoughts, answered our questions. And so the notes that were organized, that were taken, were organized, and the list of suggested changes for policies and initiatives were compiled from both of those town halls. A lot of the issues really focused on student diet and nutrition, physical activity, stress management, and there were a few other policies in there as well. We then had our experts and our student input. So graduate students came, which we felt was a representation of our undergraduates. Graduate students and undergrads in this project were working very closely together. And so graduate students worked on behalf of those undergrads and themselves, and they also worked with our PhD level experts. So they reviewed the list. Things were changed, modified, merged together. And we determined that students would look at the list and determine whether, they thought it was of high priority or low priority on a like scale. So it was a 5-point scale. And this is what we felt was the best way for participants to answer the questions. And the data would present the top 5 campus priorities. We then did cognitive interviews with both experts and college students. Our experts gave us wonderful feedback on, our grammatical revisions and our word choices, and were things simple enough for our college participants to fully understand, and were we asking the right questions? And then for our college students, we wanted to make sure what we were asking was what they were interpreting. And so they really helped us bring things to modern day. So we asked a question about advertising, for example, and we removed the word billboards and magazines. Magazines are pretty obsolete these days for college students. And so it was very appropriate to ask our priority population to ensure we were asking the right questions in the right way. So we used our randomized control trial for our project. And so we had about 7,700 college students take our survey. We had lots of questions about health behaviors, of course, campus priorities and demographics. Here are characteristics of our participants, as you can see. And these were from about 60 colleges and universities across the country. So a very great sample and representative of the United States. So we were pleased with the variety of participants that we could have for this. So we did do factor analysis. We had a lot of points and surveys and priorities that we had students really look at. And we wanted to do factor analysis to see if there were any latent constructs. And so we split our sample in half, and we did exploratory factor analysis, and then we did confirmatory factor analysis to confirm what exploratory factor analysis was showing us. Our two samples did not differ when they were split up, so we felt safe and to continue on testing. And we had 5 extracted factors. And so we had food-related options and programs, campus services and programs, health promotion efforts, food access, and additional policies. So you can see here what was included in our food-related options and programs. And this was our first extracted factor. It was bolded here, but it is no longer, so I apologize. And so you can see here all of the different points. For our campus services and programs, here we go. We have it bolded, our second factor. Free water, quality recreational facilities, free counseling services, things like that. Factor 3 were health promotion efforts. You can see the loadings there, all above 0.4. Healthier food options must be clearly labeled in all campus dining halls. A wellness course must be required for first-year and transfer students, and things like that. Food access. So this was our fourth factor. Having food accessible to students 24 hours a day. Students are up late at night studying, and they felt like this was a priority of theirs during our town halls. And then additional policies. So a policy that can support breastfeeding, transportation, biking on campus, all wonderful policies that fit into our fifth factor. So out of those roughly 7,700 students, our priorities, our top 5 priorities were as listed here. And interestingly, and the data isn't shown here, but it didn't matter the size of the school, the diversity of the school, where the school was located, what region, or whether it was rural or urban. Free water must be available at all campus dining venues, recreational and educational facilities, and residence halls. This was the #1 priority across the board. You know, that can be a whole different discussion and something that might need to be worked on across our institutions. But it was a very interesting finding. And you can see here our top 4. So healthy food options available on campus, and the campus must be safely accessible by walking in campus, and quality rec facilities, programs, classes, and resources must be easily accessible to all students. So some limitations. Not all of our priorities were applicable. So one of our experts suggested to put a non-applicable response for this survey, which we did. And, you know, that kind of washes out those priorities, but some students in some schools might think that, you know, it's applicable and some may not. So it's recommended to look at the list and before implementing the survey in your community, to remove the priorities that you feel are not applicable. It doesn't capture short-term change in priorities. These priorities are long-term initiatives, policies, so it's not going to be able to really, you know, changes aren't really going to be able to be seen in this tool. It is more of a checklist to ensure that anything that you are doing on your campus is worthwhile. So it's a wonderful way to assess health priorities of the college community. I think it's a wonderful way to not waste money and resources and time, and to figure out what your students want. It's also, further validation and testing is needed. As I said, having it validated with administrators and faculty and staff would be really important to capture the entire community. If you would like more information or if you would like this survey, please email me. You can see there. I'm happy to talk about it at any time. Thank you so much and have a lovely day.